Okay, today we're going to talk about foreign object removal from pediatrics population. So let's get started. Before we begin, I want to point out the differences between foreign bodies. Now, these can either be classified as inorganic or organic. In general, inorganic materials are typically plastic or metal. And organic foreign bodies include food, rubber, wood, sponges, and these tend to be more irritating to the nasal mucosa. And as a result, they usually provide earlier symptoms. So let's start off with the nose. The most common locations for foreign bodies in the nose are going to be to lodge in the anterior to the middle turbinates, or just below the inferior turbinates. These are most commonly encountered are beans, other food items, beads, pebbles, paper wads, and eraser tips. Again, here's a diagram that's going to be showing the anterior middle locations of the turbinates. And again, the most common locations for foreign objects to be located in the nasal cavity. So now here's a how-to. Now, how would you remove a foreign object in the nasal cavity of a pediatrics patient? First, after initial inspection, using a nasal speculum and bright light, you want to suction out any purulent discharge. If the patient is able to cooperate, have him try to blow his nose to remove the foreign object. Before attempting any removal using surgical instruments, a potentially uncooperative child must be firmly restrained and sedated. Alligator forceps should be used to remove cloth, cotton, or paper foreign bodies. Pebbles, beans, and other hard foreign bodies also need to be removed with alligator forceps. Some objects may also be rolled out by getting behind using an ear curette. And here is a picture of an ear curette. Further, you want to irrigate any loose foreign bodies or debris from the nasal cavity and posterior nasopharynx. To do this, you simply insert the bulbous nozzle of an irrigation syringe into the nostril while the patient sits up and forward. Ask the patient to close off the back of his throat by repeating the sound "eng" and flush the irrigation solution out through the opposing nostril and into an emesis basin. After the foreign body is removed, inspect the nasal cavity again and check for additional objects that may have been placed in the patient's nose. Now here is a YouTube video that's going to be showing a medical procedure removing a button that was enlarged in the nose of a pediatrics patient. And as you can see, this child is being very cooperative, which is making it easier for the medical provider to remove this button.
Okay, and now we're going to talk about the ear. Ear foreign bodies are quite common in children due to their curiosity. The most common objects children place in their ears are food material, beads, toys, pencil erasers, and rocks. Most cases are not too serious, but should be removed as quickly and safely as possible. Here is a picture of the anatomy of the ear and how a foreign body can get lodged into the ear canal. So to remove an organic ear foreign body, you use an otoscope and you want to observe the location and depth of the foreign body. Move the otoscope lens to one side and carefully introduce the alligator forceps. You want to slowly advance the forceps, being careful not to push the object further into the ear canal. Grasp the foreign body and gently withdraw the forceps. You want to make sure you check for complete removal. And here's a video that will start in just a second on a removal of a dead insect in an ear. To remove an inorganic ear foreign body, you want to attach a 20-gauge angiocatheter to a 60 milliliter syringe. You place the flexible angiocatheter tip gently in the external auditory canal. Slowly inject warm, normal saline or water until the foreign body washes out, and always confirm complete removal. Contraindications for ear foreign body removal are the presence of tympanic membrane perforation, contact of the foreign body with the tympanic membrane, incomplete visualization of the auditory canal, and if button batteries are involved, emergent ENT consult is needed due to time-sensitive liquefaction necrosis, leading to further complications.
All right, so now we're going to talk about ingested foreign bodies or objects. In the U.S., around 1,500 deaths per year occur during foreign body ingestions. About 40% of incidents are not witnessed, and the majority are asymptomatic. So clinicians must maintain a high level of suspicion. In young children, they're the most at risk for foreign body ingestions, and mainly due to their curiosity. Lots of time parents will just basically say, don't put that in your mouth, and it still happens. One of the most common objects ingested by children are coins. So here are some common signs of ingestion. Some of them will lead you to do an emergent trip to the ER or just go to an urgent care, but they include gagging, irritability, pain in the neck, throat, or chest, recurrent aspiration pneumonia, respiratory distress, stridor, vomiting, wheezing, blood and saliva, drooling, dysphagia, fever, and food refusal. Here are some management expectations for every pediatric patient that you see. Small objects that are smooth and blunted may pass through the GI tract without major damage. And ingested objects range from button batteries to hot dogs. In more severe cases, complete airway obstruction can cause respiratory distress and failure. Objects are most likely to occlude the main right stem bronchus, since it's the most upright, and they can also block the trachea. Management of foreign bodies in such locations include bronchoscopy. In the management of foreign bodies, there are several treatment algorithms that are helpful and available. Imaging is also indicated in all cases, including biplane radiographs of the neck, chest, and abdomen. They will help you see foreign objects that are lodged in odd positions. Treatment and management then varies if the object is radio-opaque versus radiolucent. Another common location for objects to lodge is in the esophagus. After imaging, a laryngoscopy, endoscopy, or duodenal sweeps may be performed. Objects that have been lodged for more than 24 hours should be removed by endoscopy. And several complications can arise from foreign body ingestion, such as mucous diverticulum, GI tears, burns, airway compromise, abscess formations, and several others. So here's a radiographic presentation of various pediatric patients that we've seen in the past. It may help you identify some obscure objects. So here's a radiograph of an 18-month-old child, and it's showing a large nail that she swallowed, and it's located in her abdomen. Here is an ingested foreign body in a 2-year-old girl with several left-sided pneumonitis and empyema that required a tracheostomy. Here's a radiograph of an 8-month-old boy with vague respiratory symptoms, and it shows a thin linear opacity in his trachea. Again, just another foreign body, and you can scroll through the rest of the slides.
And that concludes our presentation today. I hope you enjoyed it.